first we can cover up full chemotherapy. Okay, the basic things. Just I will tell the basic thing, then we will go for questions. The first one is, what is bacteriostatic? What is bactericidal? So what is bacteriostatic? Just it inhibits the growth. Bactericidal means it kills the organ. Okay, it's a basic. Then just a few points about combination of drugs. So what is synergistic and what is antagonistic? What is synergistic? Synergism means it will enhance the effect of other drugs. So if you give two drugs means the drug which enhances the effect of another drug is called synergistic. So if you give a combination means it is very effective. When compared to antagonism, it will inhibit the effect of other drugs. This is a basic. Then this is a common thing about all the chemotherapy drugs. So how it acts? Penicillin. Penicillin groups are beta-lactam antibiotics. So beta-lactam, which mainly covers gram-positive. Mostly it covers gram-positive and chlamydial infections. Then sulfonamides, cephalosporins also a beta-lactam. Sulfonamides, cephalosporins, fluoroquinolones, argan and carbapenems. Among this, the cephalosporins and carbapenems are beta-lactam. Okay, these will cover also gram-positive and also gram-negative. Actually, in beta-lactam, the first discovered drugs are penicillins. Then it comes cephalosporins. So, later inventions are mostly against more organisms. So, first penicillin means it covers only gram-positive. Next, the newer inventions means they will invent with more organisms. So, it covers also gram-negative and effective against many resistant organisms. So, cephalosporins, carbapenems are effective against gram-negative also. Okay, the next we will go to streptomycin. Streptomycin is a what group of drug? Aminoglycosides. So, it mainly covers only gram-negative. So, streptomycin is gram-negative and what is mycobacteria? Tuberculosis. So, you are using in streptomycin and tuberculosis. Then tetracycline. Tetracycline and chloramphenicol is the broad spectrum. So, most of the organisms will be covered. Then isoniazid is the tuberculosis. Then polymyxins and vancomycins are that beta-lactam. So, and polymyxin mainly has the gram-negative. It's topical. It mainly covers gram-negative. And vancomycin is gram-positive. This is newer drugs among beta-lactam antibiotics. So, this is the basic of all organisms among drugs. Then we classify chemotherapy drugs according to this, cell wall, then cell membrane, protein synthesis, nucleic acids and antimetabolites. So, how it acts? As a bacteria, just consider the cell wall. So, first a drug penetrates the cell wall, then cell membrane. A drug which inhibits the cell wall synthesis, complete organism will be died. Then some drugs will act in cell membrane. Then inside, it will go inside and it will act in what are the steps in DNA synthesis, protein synthesis, RNA, then protein. Then in nucleic acids, DNA. So, the steps, every step has some antibiotics which acts. Okay. So, these are the steps. So, these are examples. What is cell wall synthesis inhibitors? Like penicillin, cephalosporin, beta-lactams are mainly cell wall synthesis inhibitors. And what is this cell membrane? Plasma membrane, mainly polymyxin. Then synthesis of protein synthesis, mainly protein synthesis is chloramphenicol tetracycline, erythromycin and streptomycin. These are aminoglycosides also. These are protein synthesis inhibitors. So, among cell wall, the beta-lactam antibiotics, cell membrane is mainly polymyxin B and protein synthesis, other group of drugs, broad spectrum, aminoglycosides and macrolides. Erythromycin is a macrolide. Then among this enzyme activity, sulfonamides. How it acts sulfonamides? By inhibiting the enzyme folate synthase, sulfonamides. So, by acting in the enzyme synthesis, inhibition of synthesis of metabolites, mainly for DNA and RNA synthesis, there is a folic acid synthesis is important. So, that enzyme, polysynthase enzyme is these two are sulfonamides. Then by nucleic acid replication transcription means quinolone and rifampicin. So, these are all the basic drugs among chemotherapy, how it acts. So, most of the basic questions they will ask in your exam. What is the mechanism of action of these drugs? It's very easy to cover these questions. Then next, among cell wall synthesis, this is very tough. Actually, you can learn this. Cell wall synthesis, there are some steps, every step. So the basic now, cell wall, cell membrane, protein synthesis, nucleic acid. Among cell wall synthesis, how it acts? The first step in cell wall synthesis, that L-alanine is converted into D-alanine. Okay, this enzyme is catalyzed by alanine ligase. Alanine ligase and alanine racemase. These two enzymes are inhibited by cycloserine. Cycloserine is the cell wall synthesis inhibitor. So the first step, this is cytoplasm. This is cell membrane. Outside is cell wall, outer membrane. So inside the cytoplasm, the L-alanine is converted into D-alanine. And D-alanine is combines with another D-alanine to form this D-alanine. So that enzyme, it is catalyzed by two enzymes, D-alanine racemase and D-alanine ligase. These two enzymes are inhibited by cycloserine. So if a question comes like cycloserine acts by inhibiting which enzyme, so you can write as ligase or racemase. So next step, the D-alanine. Actually this is UDP muramic acid, N-acetyl acid. It combines with the UDP N-acetyl glucamic acid. So this step, that UDP glucamic acid is converted to muramic acid, is by inhibited by phosphomycin. The first drug is cycloserine, then is phosphomycin. Then all the UDP will combine together, and this unicamycin is no needed. Then it will cross the cell membrane. Okay, this action is inhibited by vesitrasil. So in the cytoplasm, D-alanine to L-alanine, then UDP glucamic acid to muramic acid. Then all these combines to and it cross the cell membrane. This action is inhibited by vesitrasil. And after it crosses the cell membrane, in the outer membrane there is a transglycosylation reaction, glycosylation. This transglycosylation reaction is inhibited by vancomycin. Then this transglycosylation is followed by transpeptidation. This transpeptidation is inhibited by beta blockers. So all the drugs among cell wall synthesis, cycloserine, phosphomycin, vesitrasil, vancomycin, then beta lactam. So the enzymes, each enzyme you have to know. This transglycosylation and transpeptidation is important. Vancomycin will inhibit transglycosylation reaction and beta lactams will inhibit transpeptidation reaction. So this is the mostly they will answer this question. And vesitrasil will inhibit this bactrophenol action will take place, the pyrophosphorylase enzyme. So vesitrasil will inhibit this reaction. So mostly they will ask these questions, transglycosylation and transpeptidation. Okay. So next slide. Next is, so the cell wall is over. Cell membrane. So drugs among cell membrane is polymyxin, B and E. It is also called colistin and tyrotropin. Mostly the polymyxins are topical. Topical preparations only. How it acts, polymyxin. I told you before, no? The first diagram. Organisms, polymyxin. Gram negative. So it acts in gram negative bacteria. And it also acts. Pseudomonas is that gram positive or gram negative? Pseudomonas is the gram negative. Okay, this is a very virulent organism, Pseudomonas. Okay, most of the drugs are Pseudomonas against resistant alcohol. Some drugs will be Pseudomonas sensitive. And this polymyxin also it is effective against multi-drug resistant Pseudomonas. Okay, this polymyxin is available only as a topical preparation and it is effective against gram negative organism and also a multi-drug resistant Pseudomonas. The next are polyene antibiotics. Other drugs, among other antibacterial drugs, antibiotics, polyene antibiotics, amphotericin B, nystatin, hamazine and apamazine. These also against cell membrane. And others, azoles, ketoconazoles, fluconazole, itraconazole, antifungals. These drugs are also effective against cell membrane. Next, so cell wall is over, cell membrane is over. Next we will go to protein synthesis. So among protein synthesis, there are steps in protein synthesis. 30S ribosome and 50S ribosome. This is 30 and this is 50. What are the steps in protein synthesis? That A site, P site, it will go from this to that and this. Okay. First thing is it will combine with the P site. Okay, and it will transfer and the new nucleotide will attach to the A site. Acceptor site will accept. So the new nucleotide will attach to the A site. The first step is the new nucleotide will attach to the A site, new amino acid. The first step is that one, to the A site. So the first step is that. Next, this amino acid in the P site will go and transfer to the A site. First this blue one attached to the acceptor site. Okay va. Adukapram this green is attached to this site. P site to A site. Then this whole A site will transfer to P site. Then the A site will be empty. This is P. In the A site lende P site vanducha. Inge empty aicha. So next acceptor, next amino acid will be accepted. So first an acceptor site will be empty. So new thing will come and accept. New amino acid will come and bind. So next the P site amino acid will go and combine to the A site. The whole thing will go back to P site and the A site will be empty. So again new one will occur. This is the basic steps in protein synthesis. Among this the drugs, just remember as ATC bus. ATC bus solluvaanga. ATC aminoglycoside, the first step. Aminoglycoside blocks the initiation complex. It acts both in 30S ribosome and 50S ribosome. So main initiation complex ATC, the first one is aminoglycosides. It inhibits the initiation complex and acts in both 30 and 50S ribosomes. The second one is tetracycline. It blocks the binding of the tRNA to the A site. The first step is binding to the A site. So that's the first thing. So first is ATC, first initiating. This is a bus starts na. What is the initiation? So the first aminoglycoside will affect the initiation reaction. The next one is the binding of tRNA to the A site. So that is for T, tetracycline. Then C, chloramphenicol blocks the transfer of peptidation from P site to A site. So what's the next step? P to A, then only A to P. So next step is it blocks the transfer of peptidation from P to A site. Next is macrolides. So among this ATC is over, other drugs is for protein synthesis is macrolides. So macrolides is inhibits the translocation from the A to P. Macrolides, lincosamides and streptogramins. All these drugs act in this reaction. And the last one is linezolid. This is a newer drug which also inhibits the initiation reaction of 23S of 50S ribosome. The last one linezolid. Linezolid is actually it will act in the initiation itself. It's a newer drug. Okay, so it acts different number 23S of 50S ribosome. So protein synthesis is clear. ATC, then macrolides. ATC A is aminoglycosides, which mainly acts in the initiation. T is tetracyclines. Binding tRNA to the A site. C chloramphenicol from P to A site. Macrolide from A to P site. Linezolid is initiation of 23S ribosomes. Okay. Then nucleic acid. So the cell wall is over, cell membrane is over, protein synthesis is over. Cell wall, what are the drugs? First step, what? Enzyme and what drug? Cyclosadine. Then phosphomycin, bezitracin, transglycosylation, vancomycin, beta-lactam. Cell membrane, polymyxin, mainly gram-negative. Now other drugs, choline, antibiotics and the azoles. Protein synthesis, what are the drugs? ATC, M. Aminoglycoside, tetracycline, chloramphenicol, macrolides, linezolides. Protein synthesis. Next is nucleic acids. Nucleic acids, among nucleic acid, DNA gyrase. First, fluoroquinolones. What are the drugs in fluoroquinolones? You will give doxycycline patients. Doxycycline is a tetracycline. Fluoroquinolones. Cipro, ofloxacin. These are fluoroquinolones. DNA gyrase, which is a topoisomerase. Okay. Then is RNA polymerase inhibitor is rifampicin. What is the rifampicin? Tuberculosis. Then direct DNA damage by metronidazole and nitrofurantoin. And nucleotide or nucleoside is antiviral. Antiviral drugs acts in the nucleoside analog nucleotide. The most common, all the drugs among nucleic acid. Actually, for entrance preparation, you have to get a separate note for each subject. Okay. So the classification based on type of action. Just now we have completed site of action. This is type. They can ask what are the drugs under bacteriostatic, what are the drugs under bacteriocidal. You have to remember some things. For bacteriostatic, static is protein synthesis inhibitor. Most of the protein synthesis inhibitor is bacteriostatic, except aminoglycosides and streptograms. They are bactericidal. So protein synthesis inhibitor drugs. Tigecycline is a new one or not? Okay, minocycline or conditioner. So all the protein synthesis inhibitor except AS, aminoglycoside and streptograms. Then drugs affecting DNA is nitrofurantoin and novobiosine. Others is quinolones and metronidazole. Quinolone is the which enzyme is inhibited? DNA guidance. And metronidazole. These two drugs are bactericidal. And drugs affecting metabolism, sulfonamides, dapsone, PAS, trimethoprim and ethambutol. These are among bacteriostatic. And all cell wall synthesis inhibitor is bactericidal. Because initial step is so bactericidal. And first line ATT drugs except ethambutol. Ethambutol here it is a bacteriostatic. So ATT drugs, if you are studying ATT drugs, you have to read the difference. The ethambutol is a bacteriostatic. Other drugs are bactericidal. So among bactericidal, all cell wall synthesis inhibitor, ATT drugs except ethambutol, protein synthesis inhibitor like aminoglycosides and streptogramins, and other DNA synthesis, quinolones and metronidazole. It is easy to remember these bactericidal. So you can write. Okay, one. Okay. Okay, then we go for questions. So, okay. What is the enzyme inactivation is the mode of resistance? What is the enzyme resistance? What is the resistance? Drug resistance. So mostly I covered only dental pulse questions. You studied our dental pulse? Pharmacology? Okay. What is the enzyme inactivation is the main mode of action of resistance? Aminoglycosides, quinolones, rifamycins and glycopeptides. How? Aminoglycosides, how it acts? What are the organisms it will cover? Aminoglycosides, streptomycin the first. Which organism? Gram negative. Okay, just I will tell about drug resistance. So drug resistance, it may be natural or it can be an acquired. So an acquired resistance mainly due to a mutation. It may be a single step mutation or multi-step mutation. So this is a 3 steps in drug resistance. The first one, may act through bacterial transformation. Transformation is just it releases a resistant DNA which will contact the other recipient cell. Just it release a resistant DNA, a gene which is drug resistant, and it will contact the other cells, other bacteria. For transformation. And the drugs which is mostly among this transformation is penicillin G. So penicillins will transfer the resistance by means of transformation. Other one is transduction. Transduction is by means of a bacteriophage. It will release a bacteriophage and it will contact the other bacterial cells. Among transduction, penicillin also acts erythromycin and chloramphenicol. And other one is conjugation by means of sex by contact. And the drugs are chloramphenicol and streptomycin. So these drugs are by means of these mutations: transformation, transduction, and conjugation. And the next other types of resistance. Mechanism of resistance. Other mechanism is by means of decreased affinity of the target. Any altered penicillin binding proteins for gram-positive bacteria, there will be penicillin binding proteins in the outer membrane. So any altered penicillin binding protein, there will be a resistance. Mainly the organisms are pneumococci and staphylococci. Pneumococci and staphylococci are gram-positive. So penicillin is effective against gram-positive organisms. Any altered penicillin binding protein to these organisms means it will become resistant. So among decreased affinity for target is these drugs. And alternate metabolic pathway. Main metabolic pathway drugs in the folic acid synthase. Which drugs will act in the folic acid synthase? Sulfonamides. In sulfonamides is the first chapter. Okay. Sulfonamides mainly metabolic pathway. Any altered enzyme, folic acid synthase enzyme, any altered affinity, it will affect sulfonamides. It will cause resistance. The other thing is enzymes. By producing beta-lactamase, which drugs? Which organism will produce beta lactamase? Mainly penicillin resistant route. So gram-positive organisms will produce beta lactamase enzyme, and the other drugs means by acetyl transferase is produced by chloramphenicol. Acetyl transferase enzyme will inhibit chloramphenicol, and aminoglycosides inactivating enzymes also. Gram-negative organism will produce aminoglycosides inactivating enzymes. So for penicillin, the gram-positive organism will produce beta lactamase enzyme. For chloramphenicol, the enzymes will be acetyl transferase. And for gram-negative organism will produce some aminoglycoside inactivating enzymes which will inactivate the drug, and it will not inhibit the organism, and it will become resistant. And the other thing is decreased drug permeability. Gram-negative aminoglycoside. So gram-negative has an outer cell wall, cell membrane. So decreased permeability. And for tetracyclines. And efflux pumps is TET pumps for tetracycline. And for erythromycin and fluoroquinolones. Tetracycline, erythromycin and fluoroquinolones. So among enzyme activation, beta lactamase, acetyl transferase by chloramphenicol, and aminoglycosides. So the question is, quinolones acts by the last step, efflux pump, tetracycline quinolones, erythromycin. So aminoglycoside acts by, so this answer is aminoglycosides. And rifamycin, glycopeptides are same like, actually for rifampicin there is a mutation, gene mutation. For ATT you will read for RMP gene, RPOB gene mutation. And for glycopeptides also, actually the glycopeptides are newer drugs. Until now there is no resistance. Okay. So among these 4 answers, you can cut it off. Rifamycins are rifampicin and glycopeptides. If you know which is how it acts, aminoglycosides and quinolones, you can answer it easily. So enzyme is aminoglycosides, penicillins by beta lactamase, chloramphenicol by acetyl transferase. So the answer is aminoglycosides. Next, we go for beta lactamase. What are the drugs means? Penicillins, cephalosporins, monobactams, carbapenems. So which of the following is not a uridopenicillin? What is the classification of penicillin group? You know the classification of penicillin. So okay, just answer this question. What are these drugs? Uridopenicillin. Okay. What's the question? Which of the following is not a uridopenicillin? So this is the classification of penicillin. The first one is acid resistant. The first drug, acid resistant, the first drug is penicillin G. Alternative to penicillin G is penicillin B. Then penicillin A is resistance, that is beta lactamase resistance is methicillin and cloxacillin. Then extended spectrum penicillins is aminopenicillin, carboxypenicillin, uridopenicillin. Aminopenicillin, ampicillin, decampicillin, amoxicillin, the common drugs, oral drugs. Then is carboxypenicillin is carbenicillin and ticarcillin. Then uridopenicillin is piperazillin, mesclocillin. This is beta lactamase inhibitors. Beta lactamase inhibitors, clavulanic acid, sulbactam, tazobactam, and this is a newer one, avibactam. Latest one. Clavulanic acid, what combination drugs you have heard about clavulanic acid? Common. அதே கொடுப்பீங்க நீங்க உங்க ஹவுஸ் சர்ஜன்ல என்ன ட்ரக் கொடுத்தீங்க? ஆன்டிபயோட்டிக், அமாக்ஸ்கிளாவ். ஓகே. சல்பாக்டம், செஃபோபெரசோன். பிப்பரசிலின், tazobactam combination drug. Piperacillin, tazobactam. Cefoperazone, sulbactam. The combination available. And this avibactam is combined with ceftazidime. Ceftazidime. This is newer one, new combination. So among the uridopenicillin, the drugs are piperacillin, mesclocillin. So what is the answer for that question? Piperacillin, mesclocillin, acetylocillin, everything is uridopenicillin. Flucloxacillin is before that. It is aminopenicillin. Actually, this is penicillin system. Methicillin, cloxacillin, flucloxacillin, like that. So among the names you can cut it off. Piperacillin, mesclocillin, acetylocillin la ஒரே terms ஆ வரும். அதெல்லாம் uridopenicillin. Cloxacillin la முன்னாடியே கண்டுபிடிச்சிருக்காங்க. அதுல வந்தது தான் flucloxacillin. Okay, the next question. All of the following statements about penicillin binding proteins are true except. What is penicillin binding protein? Penicillin will bind to penicillin binding in the outer membrane. So it presents on the cell surface. Mutation in the penicillin binding protein gives rise to resistance. These are target site of vancomycin, and these are targeted by imipenem. So they are present in the cell surface is right, and their mutations cause resistance. So vancomycin and imipenem resistance. What is vancomycin? It is also a beta-lactam antibiotic, human one, and imipenem is monobactam, carbapenem. Carbapenem is imipenem. The newer drugs, actually penicillin and cephalosporin. Next to that, carbapenem and monobactam. These resistant organism is covered by these drugs. So it is very effective. That means there is no resistance. Actually, for imipenem there is a resistance. That's the thing. But vancomycin is a very newer one. It is effective even against the resistant streptococcus. Penicillin resistant streptococcus, VRSA, MRSA. So first is MRSA, then is VRSA, VRE. So vancomycin is effective against MRSA. So that means there is no resistance. So the answer is C. Actually, penicillin binding protein is a transpeptidase. Actually, penicillin binding protein enzymes it's like a transpeptidase enzyme. What is transpeptidase? Beta-lactam will inhibit transpeptidation. Okay? So it's similar to transpeptidase enzymes. So beta-lactam will be effective against transpeptidase. But vancomycin, how it acts? Vancomycin enzyme. Transglycosylation, then transpeptidation. Okay, wow. So the enzyme is different for vancomycin. First transglycosylation, then only transpeptidation. Beta-lactam will inhibit transpeptidation. So the before step is transglycosylation. Vancomycin will inhibit transglycosylation. So penicillin binding proteins are similar to the transpeptidase enzymes. And the enzyme is the penicillin binding proteins. So the mutation in penicillin binding proteins will not affect vancomycin, because vancomycin mainly inhibits transglycosylation. So the answer is that there is a target site for vancomycin. So penicillin binding proteins are transpeptidase and similar enzymes involving cross-linking. Cell wall synthesis cross-linking transpeptidation. That last D-alanine will cut. So on the step, penicillin binding proteins are similar to transpeptidase enzyme. So vancomycin acts by inhibiting transglycosylation. You want the picture? This is transglycosylation. The next step is transpeptidation. Okay, vancomycin acts by this step, transpeptidation. Penicillin binding proteins are similar to, you see this TB, transpeptidase. Okay, so penicillin binding proteins are similar to transpeptidase and other similar enzymes involved in cross-linking. But transglycosylation is affected by vancomycin. So for that question, the answer is, it is not inhibited by vancomycin. The other target site of vancomycin is the answer. Okay. Clear about this question? And the other newer drugs around vancomycin is telavancin, dalbavancin, oritavancin. These are newer drugs. By the names you can identify. Okay, next question. Beta-lactamase. So penicillin binding proteins is clear about penicillin binding proteins. Next is beta-lactamase. So what is? Which of the following statement is false about external spectrum beta-lactamase? There are many beta-lactamase. There is a classification for beta-lactamase. Okay. The first, they can hydrolyze penicillin, cephalosporins and monobactams. The carbapenems are sensitive to external spectrum beta-lactamase. And amber class of external spectrum is based on structure difference. There is two classifications. And all third and fourth generation cephalosporins are used for detection of external spectrum. Just I first clear about what is beta-lactamase. This is the classification of beta-lactamase. The functional group is based on Bush classification, and the molecular or structural classification is based on Amber classification, and it is inhibited by the drugs. What are the drugs among beta-lactamase inhibitors? Beta-lactamase inhibitors drugs in clavulanic acid, tazobactam, sulbactam. Newer one? Okay. Apart of substrate. Substrates means it will inhibit which drugs? Okay. The first one is cephalosporinase. The first type. Actually for functional group you name as 1, 2, 3. In Amber classification you name as A, B, C, D. Okay. So the first cephalosporinase 1. It is class C. It mainly the substrate is cephalosporins, cephamycins and astrione. The next one is serine beta-lactamase. First one is cephalosporinase. Second one is serine beta-lactamase. Third one is metallo-beta-lactamase. Okay, va? So this is the zinc metal amines. So three classifications: cephalosporin is serine beta-lactamase and metallo-beta-lactamase. It's the metal is zinc. Okay. Among serine beta, there is a penicillinase, extended spectrum beta-lactamase, carbonicillinase, and oxacilinase. Okay. So penicillinase is among 2A, 2B, and this substrate is penicillin G and cephalosporin. So among serine beta-lactamase, clavulanic acid and tazobactam will inhibit. Okay. And among extended spectrum beta-lactamase, the substrates are, for penicillinase it is penicillin G and cephalosporin. And for extended spectrum beta-lactamase it is penicillin, cephalosporins, oxyminobeta-lactam. The oxyminobeta-lactams are cefotoxin, ceftazidin, ceftriaxone, cefepime and astrium. Mostly cefotoxin and ceftriaxone you will give in your word. Other end of ceftazidin, then cefepime, astrium. These are oxyminobeta-lactams. So just remember for penicillinase. Penicillinase is penicillin G and cephalosporins. And for extended spectrum beta-lactamase. Otherwise, no virulent are. Adukku vandu penicillin, cephalosporins, because they are older drugs. Sure, kandipa they are resistant. Among cephalosporins, there is oxyminobeta-lactam. The third generation groups are called oxymino. Among this, cefotoxin, ceftriaxone, ceftazidin, cefepime and astriolum. Then carbonicillinase is carbonicillin by this name, carbonicillin. Oxacillin is oxacillin, cloxacillin. Okay. Then metallo-beta-lactamase is carbapenems. It is inhibited by EDTA, not some beta-lactamase inhibitors is not. Okay, it is only inhibited by EDTA. So, cefamycin, the first one, cephalosporinase. Cefamycins are cefoxetine, cefametazole and cefotetan. Metazole-tetan. Cefametazole-tetan, cefotetan. Okay, cefoxetine, ET na vachko. Adha T something varum. Cefoxetine, cefametazole, cefotetan. Idha cefamycin. Adha cephalosporinase மூலமா inhibit ஆகும். Okay. So, என்னென்ன drugs என்னென்ன enzymes? Cephalosporinase, penicillinase, extended spectrum, among serine, penicillinase, extended spectrum, cloxacillinase and carbonicillinase. And third, last one is metallo-beta-lactamase la vandu only carbapenems. Okay. So among first one cephalosporin, cefamycin and astrium. And among serine beta-lactamase penicillinase la vandu penicillin G, cephalosporin. Extended spectrum la penicillin, cephalosporin, oxyminobeta-lactams and that's all. Carbonicillin, carbonicillin, oxacillin. Okay, va. So the answer is extended beta spectrum is they can hydrolyze penicillin, cephalosporin, monovalent. Is it correct? Extended spectrum beta. It will penicillin, cephalosporin and oxyminobeta-lactams. So everything is covered in this. Carbapenems are sensitive to extended spectrum. No. And amber class is structure difference. Bush and amber. Amber is molecular structure. And all the third and fourth generation used for reduction of extended spectrum. Yes. So the answer is B. Okay, va. The answer எப்படி make out பண்ணனும்? Usually mostly ரெண்டு கண்டிப்பா அதுக்கு இருக்காத மாதிரி இருக்கும். அதை கட் அவுட் பண்ணிட்டீங்கன்னா ரெண்டு இதை வச்சு ஈஸியா நீங்க ஆன்சர் பண்ண தரலாம். மோஸ்ட்லி எப்படி ஆன்சர்ஸை கட் பண்ணணும்னு ஃபர்ஸ்ட் பார்க்கும். ஒரு கொஸ்டினோட ஆன்சர்ஸை இதெல்லாம் ஷுவரா வராது அப்படின்னு சொல்லி டு கட் இட் அவுட். அதுக்கப்புறம் கண்டிப்பா ஷுவரா ரெண்டு தான் உங்களுக்கு குழப்பம். அது ரெண்டுல கொண்டு வந்தீங்கன்னா you can easily make it out. So among two it is easy to select the one among two. So mostly the two answers தான் வந்து கொஞ்சம் இது பண்ற மாதிரி இருக்கும். All the questions. அது ரெண்டுல வந்து கொண்டு வந்துட்டீங்கன்னா it is easy for you to get an answer. Okay, this is a basic full classification among cell wall synthesis, beta-lactam, all the drugs. Cephalosporin first, second, third and fourth, and there is also fifth generation cefepime. And carbapenems is imipenem, meropenem, carbapenem, imipenem, meropenem, etapenem, and monobactam is astrium. And beta-lactam is inhibited, clavulanic acid, salbactam, tazobactam, avibactam. The next, among the organisms, so cell wall synthesis, penicillin is mainly gram-positive. So among this, mainly pneumococcal pneumonia, mainly streptococcal, pneumococcal, staphylococcal, But among this there is many resistance for penicillins. So mainly pneumococcal, streptococcal pneumonia, and in streptococcal means mainly they will cause pneumococcal. What it cause? Pneumococcal pneumonia cause lung infections. Mostly gram-positive organisms tonsillitis in the infections. So streptococcus pneumoniae, streptococcus pyogenes and streptococcus viridans, gram-positive cocci. Among gram-positive bacilli, Bacillus anthracis and Corynebacterium bacteria. So main penicillin is gram-positive. Adala cocci bacilli. Cocci na pneumococcus, streptococcus ellame varum. Streptococcus la mostly resistant. MRSA illa vandiruchilla. Aprom among the gram-positive bacilli, Bacillus and anthrax and Corynebacterium bacteria. So diphtheria. And some gram-negative cocci, Neisseria gonorrhea and Neisseria meningitis. So gonorrheal infection ku neenga kudukalam. Main vandu silver nitrate drops in ophthalmia neonates. And also for syphilis, spirochetes. So penicillin is effective against spirochetes. Among syphilis, Treponema pallidum and Treponema pallidum. So gram-positive cocci, bacilli. Other than this, spirochetes. Okay. Gram-negative, Neisseria. And the spectrum. Ampicillin vandu listeria it also effective against listeria. Munadi enna sonna bacilli, two bacilli. Bacillus and Corynebacterium. And ampicillin is adukapra convolution. So it is effective also against listeria. And other gram-negative rods, E. coli, Haemophilus influenza, Proteus mirabilis and Salmonella typhi. So for typhoid also they will give ampicillin. And for E. coli infections, and also for Haemophilus influenza. That is also LRI, lower respiratory infection. And others extended spectrum, carbenicillin, ticagrelin, piperacillin, you go with more gram-negative. So ella gram-negative, main on the Protease, Haemophilus influenza, Pseudomonas. Adala romba virulent organisms. So innum nalla effect agum. Adukapram vandadhu. So ampicillin vandu extra va partha listeria, apra other gram-negative, initial vara gram-negative, Haemophilus, E. coli, common vara. Adha vida virulent organisms vandu indha carbenicillin, ticagrelin idella. Pseudomonas, Enterobacter idella. Apram this is natural penicillins, penicillin G and penicillin B, anti-staphylococcal, mainly for staphylococcal aureole infection, tonsillitis, dicloxacillin, methicillin, ampicillin, amoxicillin. Extended spectrum is ampicillin and amoxicillin. Amoxiclavulinic acid, ampicillin plus sulbactam. Another one is anti-pseudomonal. Pseudomonal is very important. What are the drugs effective against pseudomonas is very important. Anti-pseudomonal among penicillin is carbenicillin, piperacillin, ticagrelin. Among penicillin, anti-pseudomonal is carbenicillin, piperacillin and ticagrelin. Okay, these black ones are stable to penicillinase. That means these are stable to penicillinase enzyme, beta-lactamase enzyme. They will not inhibited by beta-lactamase enzyme. Okay. Pseudomonas, anti-pseudomonas is very important. Among penicillin, it is carbenicillin, piperacillin and ticagrelin. தூக்கம் வருதா? சாக்லேட் வேணா வச்சிருக்கேன்ப்பா. Okay. This is common reaction. Mostly penicillin means hypersensitivity. Okay, hypersensitivity and diarrhea. Ampicillin will cause diarrhea. And nephritis, neurotoxicity, hematological toxicity and cation toxicity. So main hypersensitivity. Penicillin is hypersensitive, you should not give beta-lactams to either patients. So they will also sensitive to cephalosporins. That's the most common thing. Next, what is Jarry's eczema reaction? It's treated by administering antibiotics. How it comes? What is Jarry's eczema reaction? Syphilis patients penicillin kodutha varum. So appo enna treatment பண்ணுவாங்க? So mostly for any reaction they will use steroids. Tetracycline. So how it cut down the answer? So IV penicillin G. So penicillin கொடுக்கிறதுனால தான் வரும். திருப்பி நீ penicillin கொடுக்க போறதில்ல. But you will continue the treatment. You don't need to stop the treatment. So you can cut it out this answer. Next one is antihistamines. So mostly for any allergic reaction they will give steroids and antihistamines. Mostly any anaphylaxis. So you have to wait it for that answer. Next, tetracycline. There is no use of giving tetracycline to syphilis patients. There is no use of tetracycline. So you have to cut it. Then steroids. So for Janus eczema, for syphilis patients, there is no use of steroids. So for this reaction, you can wait. Mostly it will self-resolving. Just give an antihistamine. It is enough for Janus eczema, and you have to continue the treatment. You do not need to stop the treatment. So penicillin injected to the syphilis patient will produce shivering, fever, myalgia, and exacerbation of lesion. So due to sudden release of this, how it acts means due to spirochetal lytic products. Syphilis is a spirochete. Our lytic products are the sudden reaction, and which is last only for 3 days, 12 to 72 hours. So there is do not recur and no need of interruption of therapy, and aspirin sedatives are effective. Just for pain you can give aspirin and sedatives, because it will resolve within 3 days. It will not recur also. So there is no need of interruption of therapy. So Janus eczema will occur in a patient with a syphilis is on a penicillin due to lytic products of these spirochetes. So it mostly 3 days. It will not resolve. It will resolve itself, and it will not recur. No need of interruption of therapy. Just an aspirin, a painkiller, and a sedative is enough. So antihistamines is enough. Among this sedatives, antihistamines is sedative. So it's enough. Okay, the question is next. It is cephalosporin. Which cephalosporin is effective against? Among penicillin, I told you some drugs against Pseudomonas. What are the drugs? Carbapenicillin, piperacillin, ticagrelor. So then among cephalosporins, what are the drugs effective against Pseudomonas aeruginosa? You should know the classification. So the first generation, second generation, third, fourth, fifth. So most 3, 4 higher classifications effective. So if you know the classification, you can give the answer. So these are the drugs effective against Pseudomonas. All the drugs. Among penicillin, piperacillin, carbapenicillin, ticagrelor, and mesroxyline. That extended spectrum beta. Other cephalosporins, ceftazidime, cefoperazone, and cetipine. Among third generation, these drugs are effective. Okay, ceftazidime, cefoperazone, and cetipine. And aminoglycosides. So gram negative. Aminoglycosides is effective against gram negative. So basically it will be effective against these. Gentamicin, tobramycin, amikin. And fluoroquinolones, cipro and levo. And carbapenem, imipenem, and meropenem. And others, polymyxin B. I told you, polymyxin B. What drug is polymyxin? How it acts? Polymyxin. First. Cell membrane. Effective against, it is applied as, it is available as a topical, and effective against gram negative, and also even multi-drug resistant Pseudomonas. So polymyxin B and colistin. Colistin is polymyxin C. Okay, same thing. So these are the drugs among active against Pseudomonas. So the answer? Cefoperazone or other drugs? Among cephalosporin, what are the 3 drugs? Ceftazidime and cephalosporin. Okay, these some points about cephalosporin. It is used for treatment of mainly meningitis, septicemia, pneumonia. Penicillin mechanism of action, everything, pharmacological action, everything is similar to penicillin. And it has allergic reaction and cross-reactivity to penicillin. It is in broad spectrum antibacterial activity. And cephadroxil, it is a newer drug which in case of any antibacterial resistance you can use for UTA. Cefuroxime mainly for prophylactic in surgery. Cefazolin is, what is cefazolin? The main important. Surgical prophylaxis. Cefazolin is a main drug for surgical prophylaxis. And ceftazidime, it is a wide range of activity. Ceftazidime. Ceftazidime also has a wide range of activity against even Pseudomonas. Okay. Next. Okay. Almost over. penicillin cephalosporins. And which of the following drugs should not be used to treat Klebsiella infection? Ampicillin. Klebsiella is a gram negative. Ampicillin you can use. Ampicillin. Ampicillin. Gram negative. Which organism effective against gram negative for ampicillin? The diagram is on E. coli, Haemophilus, protease. So Klebsiella it will not affect. Then amikacin. Amikacin is a aminoglycoside, gram negative. It can. Then imipenem, carbapenem. Tigecycline is tetracycline. Mainly Klebsiella is intrinsic. Actually, picaillin is intrinsic resistance to ampicillin. Some organism வந்து என்ன பண்ண அதுக்குன்னு ஒரு intrinsic activity இருக்கும். And our drugs கண்டிப்பா அது போக முடியாது. அந்த மாதிரி Klebsiella வந்து intrinsically resistant to ampicillin and picaillin. So ampicillin is no use in this condition. And also you can know it is a gram positive mostly and it will not act. And then main intermediate. So Klebsiella means gram negative. You can use with amikacin, carbapenem and tigecycline. Tigecycline is a tetracycline conjugate. It is a broad spectrum. So you can go with gram negative. And carbapenem is also effective against gram negative. So these three, among these three, have to select the answer. So polymyxin B is active against highly resistant. So should not be used. It is very easy for this question. Ampicillin. Question for which drug should not be used? The first one, ampicillin. Very easy. Okay, highly resistant. Polymyxin B, topical infection is topical. Is also effective against. So this question is Purujira. Next, not true about piperacillin. What is piperacillin? Uridopenicillin. Okay, it is active against Pseudomonas. Correct. It inhibits beta-lactamase. It is a uridopenicillin. It is given parenteral. Mostly extended venous spectrum drugs it is available as parenteral. Piperacillin is available as parenteral. So this is inhibits beta-lactamase. Then what is Redman syndrome? Most common condition. Any guess? Upper tuberculosis patients. Vancomycin. Actually, vancomycin faster. Actually, how to dilute the vancomycin in IV fluids. Straight up vancomycin it will cause Redman syndrome. Sudden release of histamine. The patient will become reddish. Histamine release and full allergic reaction. Actually, during our ward setup, some houses will do this. If they don't know how to give vancomycin, they suddenly give the injection straight IV. There's certain Redman syndrome. In my period, there's one person from foreign Redman syndrome. So it is vancomycin. Vancomycin is Redman syndrome. Sudden release of histamine like this. It will cause full allergic reaction. Reddish patient. Redman syndrome. So it is vancomycin. Straight IV you have to dilute it. IV fluids dilute panni kodukkum. Straight IV faster kodutha sudden release of vancomycin. So some drugs they are having. For diazepam you have to use slow IV, slow IM or slow IV. Diazepam slow, faster sudden respiratory arrest, on table respiratory arrest. These are basic things for some drugs. And for vancomycin, Redman syndrome, the patient will be very stable before the vancomycin. If a patient becomes reddish, what they will think? It's our fault. We should know how to give. For some drugs only these are the things. How to give like this, how to give slow IV infusions. For diazepam, there is sure respiratory depression if you give fast IV. You have to dilute it and you have to very slow amount. For 10 minutes you have to give. Very slow 10 ml infusion. Mostly we will give very fast and you go. For 10 minutes you slow push. And for vancomycin you have to dilute it. IV fluids dilute it. Next, other cell wall is vancomycin. It is very important. It is mainly effective against MRSA, penicillin resistance, pneumococcal, Clostridium difficile. Main thing, Clostridium difficile. Clostridium difficile வந்து மெயினா இந்த ஆர்கானிசம் மெயினா வந்து vancomycin மெட்ரோனோடோசோல் மட்டும் தான் எஃபெக்ட் செய்யும். Clostridium difficile will cause pseudomembranous colitis. Some also antibiotic induced diarrhea. Antibiotic induced diarrhea வந்து மெயினா வந்து pseudomembranous colitis சொல்லுவாங்க. அந்த நார்மல் பாக்டீரியாவை இன்ஹிபிட் பண்ணி it will cause diarrhea. நார்மல் gut flora வெல்லாம் இன்ஹிபிட் பண்ணி. So அது மெயினா வந்து Clostridium difficile infection தான் will cause பண்ணும். So அதுக்கு effective organisms வந்து vancomycin and metronidazole. So and for pseudomembranous colitis for Clostridium difficile infection, vancomycin oral can be given. Okay, and it is the cause mainly red man syndrome. And it is as for IV treatment for septicemia, endocarditis. MRSA mainly cause endocarditis and septicemia. And it is used for pseudomembranous colitis. The superinfection of the bowel by Clostridium difficile and produces a toxin that damages the colon mucosa. So for Clostridium difficile infection away, vancomycin and metronidazole. No other thing. Okay. And other drugs are uritavancin, telavancin and dalbavancin. Okay, dalbavancin வந்து once weekly. It is also effective against VRSA. Penicillin resistant MRSA. MRSA க்கு அப்புறம் VRSA வந்துச்சு. vancomycin கண்டுபிடிச்சாங்க, அதுக்கு அப்புறமும் VRSA க்குலாம் அந்த imipenem carbapenemல எஃபெக்டிவா இருக்கு. imipenem குரூப்ஸ்ல VRSA, VRE, tigecycline இதெல்லாம் எஃபெக்டிவ். ஓகேவா? நெக்ஸ்ட் மோனோபாக். ஆஸ்ட்ரியோனம், டிஜிமோனம், கேரமோனம். இது வந்து மெயினா கிராம் பாசிட்டிவ் தான். மோனோபாக். மோனோ 1. It is not a beta lactam. Monobac. Then this carbapenem, imipenem. Main thing is imipenem. Imipenem, meropenem, ferropenem, dolipenem, razopinum. These are the drugs among carbapenem. And the one thing with imipenem is it is hydrolyzed by dihydropeptidase enzyme in the renal tubular cells. So you have to give us some other drug which inhibit that enzyme. Otherwise there is no action of imipenem. That is cilastatin. Cilastatin is a drug which inhibits this enzyme. Okay? Imipenem is hydrolyzed by this enzyme. So அந்த action போய்டும். கப்டன் வெளியே போய்டும். அதை inhibit பண்றதுக்கு ஒரு drug. It is cilastatin. So you have to give this combination of drugs. But these things will not occur with other drugs, newer drugs. Only imipenem will be hydrolyzed by this enzyme. So other drugs is not hydrolyzed by this enzyme. Okay, well. Okay, well. The only important thing for imipenem. Next, tetracycline. At least penicillin, cephalosporin, the main basic things are solid. Okay then. Next is tetracycline. Among the how it acts, tetracycline. Mechanism action. What are the drugs among cortisol? Drugs among cortisol. Inhibitor. ஞாபகம் வச்சுக்க சொல்லி கொடுத்தல ஒன்று என்ன ஞாபகம் வச்சுக்கோங்க ATC M அமினோகிளைகோசைட் டெட்ராசைக்ளின் குளோரம்பெனிகால் மேக்ரோலைட்ஸ் A வந்து எங்க இன்ஹிபிட் பண்ணும் இனிஷியேஷன் both 30 and 50S ரைபோசோம் C tRNA to A sites first A site ல வந்து பைண்ட் பண்ணனும் அக்செப்டா சைட் ஃபர்ஸ்ட் அக்செப்ட் பண்ணனும் அதுக்கு அப்புறம் வந்து T ல இருந்து A அப்புறம் தான் A to P இது அக்செப்ட் பண்ணிக்கும் இது வந்து அக்செப்ட் மட்டும் தான் பண்ணும் P ல இருக்கிறத அக்செப்ட் பண்ணிட்டு அதுக்கு அப்புறம் தான் தள்ளிவிடும் அதுக்கு அப்புறம் நகந்துரும் அந்த mRNA நியூ A site புரிஞ்சுதா ஓகே தானே குழப்பிக்க easy to remember T to A then A to P so tetracycline is first initiation A site accept பண்றது so the drugs are tetracycline chlorotetracycline and oxytetracycline group 2 is among the half life இது வந்து short acting intermediate and long acting demiclocycline and metacycline and doxy and minocycline doxy is the most commonly used oral drug tetracycline is a broad spectrum antibiotic so broad spectrum means நிறைய organisms அது ரெண்டே தான் இருந்துச்சு gram positive gram negative so all the organisms mainly gram positive bacillus anthrax and gram negative brucella vibrio cholerae yersinia pestis and anaerobic infections also it is a broad spectrum எல்லா organisms cover பண்ணும் ஓகேவா and it mainly covers anaerobic clostridium perfringens and clostridium tetani but it will not cover clostridium difficile is covered by and vancomycin vancomycin and metronidazole so ana இது வந்து அந்த எல்லா ஆர்கானிசம் சொல்லிருக்காங்க ஆனா clostridiumல அந்த டெபிசிட் சொல்லல அது மெயினா அங்க And then spirochetes, Borrelia, leptospirosis, Mycoplasma pneumonia, then chlamydia, rickettsiae, and all other gram positive and all other organisms. So it's a broad spectrum. Yeah. And mostly it is mainly minocycline. Only minocycline provides a therapeutic concentration CSF. So minocycline for meningitis kudukalam, CSF infections. Doxycycline வந்து mainly it is excretable bile. So liver. So for liver patients you cannot give doxycycline. Most commonly given drug is doxycycline. Then most tetracyclines are reabsorbed from the bile and metabolized and excreted. So it can cause for any renal toxic or any liver toxic patients, they have to decrease the dose of tetracyclines. Yeah. Okay, this is your question. I don't know how to get the answer for this question. The color of teeth stained by tetracycline appear dash under UV light. In our books, I didn't study about this. Unga question நீங்க தான் சொல்லுங்க. Tetracycline side effect என்ன மெயினா? What is the tetracycline side effect? You will give a tetracycline to a children? White. So, which color it will appear in UV light? It's yellow. சும்மாவே வெளியே பார்த்தாவே எல்லோவா தான் இருக்கும். UV லைட்ல பார்த்தா எல்லோவா தான் இருக்கும். Okay, well, just remember like this. It's given us yellow. I don't know where to search this answer. Okay. Okay, these are common side effects. Main irritative effects. Renal. Main thing. Renal is Fanconi syndrome. The outdated tetracycline Fanconi syndrome. Outdated means expired. This is the main thing. Outdated preparation will affect the proximal convoluted tubule and azotemia. This is called Fanconi syndrome. Tetracycline outdated are put the Fanconi syndrome. Okay, then liver it will cause fatty infiltration, jaundice, everything. Pregnancy it will cause acute hepatic necrosis. So pregnancy patients generally கொடுக்க மாட்டோம் tetracycline. It will cause hepatic necrosis. And phototoxicity it will cause. In diabetes mellitus, actually diabetes insipidus, demiclocycline you can use. With anti-ADH actually it reduces the concentrating ability. Demiclocycline is used in diabetes insipidus. Okay? Demiclocycline is a tetracycline. Alterima. So it is used in diabetes insipidus. Vestibular toxicity is minocycline. Minocycline will cause vestibular toxicity and hypersensitivity reactions. So main demiclocycline is some important for some drugs. Demiclocycline is used in diabetes insipidus and minocycline will cause vestibular toxicity. Commonly it will cause renal tubular damage by using outdated drugs. For teeth, you know how it acts by chelating property. It chelates the property with calcium and complex is deposited. The depositite gives staining and discoloration of deciduous teeth carries and affects the crown of the permanent anterior dentition. And repeated dosing will cause more damage. And for bone it will cause deposition, same thing, bone calcium chelation. And it also causes pulmonary eosinophilic syndrome, anti-anabolic effect, it will reduce the protein synthesis, anti-anabolic, and pseudotumor cerebrae. These are the common side effects among tetracycline. And the main thing you should not give with milk. It decreases absorption of chelation and it decreases absorption by chelation and alteration of pH. Calcium, zinc, iron preparation sort of sets up. So calcium tablets are iron tetracycline. So what are the drugs? How it acts? Main side effects. Minocycline will cause vestibular toxicity. Teeth discoloration, how it appears in UV light. Yellow. So what is the drug of choice for chlamydial infection? It's a broad spectrum, na? Chlamydia it will definitely cover. So what is the drug of choice for chlamydial infection in pregnancy? Doxycycline is the, what is the doxycycline? In a drug, tetracycline. And then tetracycline. Erythromycin is a macrolide. Fluoroquinolones is a fluoroquinolone. So mostly among, actually, so just you know how, what are the drugs that will be effective in pregnancy. Tetracycline should not give. And you can cancel even doxycycline. And ciprofloxacin and erythromycin. Among cipro and erythro is the answer actually. Actually, for chlamydial infection, doxy is a drug of choice. But it is contraindicated in pregnancy. So alone you have cut it out. And you can go with, then other drug is erythromycin. Fluoroquinolone is mostly upper respiratory. And for UTI, diarrhea, and the ciprometro, the diarrhea patients for ciprometro. Okay, understood. Okay, newer one among tetracycline, glycine-cycline, TG-cycline is the newer one. So it is a new one, only glycine-cycline antibiotic. And it is recently approved. It is a minocycline block. Minocycline is a tetracycline or analog. So it mainly binds with the same action, 30S ribosomal unit and inhibits protein synthesis. So MRSA ku vancomycin. Vancomycin oda effective modu TG-cycline, VRE. So it is effective against even VRE, VRSA, VRE, everything. So it is a newer drug and it is effective for most or the resistant organs. Then chloramphenicol. What's the mechanism of action of chloramphenicol? Dr. Sori. So this P side to A side, this inhibition. And mainly chloramphenicol also it's a broad spectrum. It will covers all the organism. Main bone marrow depression. Actually first initial before periods for typhoid infection they will give chloramphenicol. Typhoid patients. My teacher during my UG or typhoid first chloramphenicol. Avarke bone marrow depression full anemic ella sense down ஆயிடுச்சு. அதுக்கப்புறம் சிப்ரோக்வினோலோன் அந்த மாதிரி வந்துச்சு. இப்போ மேக்ரோலைட்ஸ் இதெல்லாம் நியூவர். ஸோ ஃபர்ஸ்ட் குளோரம்பெனிகால் தான் கொடுத்தாங்க. ஏன்னா ப்ராட் ஸ்பெக்ட்ரம்ல எதுக்குனாலும் கவர் ஆயிடும். ஸோ மெயின் அந்த போன் மேரோ டிப்ரெஷன் அண்ட் ஹைப்பர் சென்சிட்டிவிட்டி அதே மாதிரி தான். அப்புறம் கிரே பேபி சிண்ட்ரோம் இது ரொம்ப இம்பார்ட்டன்ட். ஹை டோஸ் வந்து given prophylactically in neonates and prematurely it is inability to excrete ஆகும். It is inability in neonates வந்து it will cause gray baby syndrome. ஃபுல்லா சைனஸ் ஆயிடுவாங்க பேஷண்ட்ஸ். ஏன்னா it is inability to excrete. அந்த என்சைம்ஸ் குளுக்கோனேஷன் என்சைம்ஸ் எல்லாம் வந்து நல்லா டெவலப் ஆயிருக்காது சில்ட்ரனுக்கு. ஸோ அப்போ வந்து டாக்ஸிசிட்டி லெவல் ஜாஸ்தி ஆயிடும். It is called gray baby syndrome. There will be no feeding, vomiting, hypotonic, hypothermia, flaccid ஆயிடும் baby. And that is irregular respiration, collapse and death. Okay. Gray baby syndrome na chloramphenicol. Okay. Following antimicrobials are termed as type 1 calcimimetics. This is a tough question. Class type 1 calcimimetic that mimics the stimulatory effect of calcium. Calcimimetic na it stimulates mimics like a calcium. So on the calcium sensing receptor to inhibit the PTH secretion. So PTH ever release out. What is PTH? So calcium ஜாஸ்தி இருந்துச்சுன்னா PTH கம்மி ஆயிடும். So calcium sensing receptor போய் stimulate பண்ணுச்சுன்னா வந்து கம்மி படுத்திடும். calcium மாதிரியே ஆக்ட் பண்ணுது. So calcium நிறைய இருக்குன்னு அர்த்தம். அப்ப PTH கம்மி ஆகும். So by the parathyroid gland except. So antimicrobials some drugs act as a calcium mimetic. Among this எது அப்படின்னு கேட்கறாங்க. அது வந்து streptomycin, hamycin, neomycin and gentamicin. இதுல என்ன drugs ன்னா actually it's a class. Calcium mimetics வந்து என்னென்ன drugs ன்னு சொல்லிடுறேன் first மெயினா. Calcium mimetics na stimulatory effect of calcium which inhibits the PTH secretion. Type 1 is there's two types of calcium mimetics. And the question வந்து type 1 calcium mimetic என்ன கேட்கும். So type 1 calcium mimetics na divalent cations, polyamines, aminoglycosides and polylysines. Polyamines, aminoglycosides and polylysines. So among antimicrobials, aminoglycosides. Then type 2 is phenylalkylamine. It will allosteric calcium sensing receptor. Just a phenylalkylamine. As well as drugs okay. Then drug which activates the calcium sensing receptor. Parathyroid வந்து அதுக்கு ஒரு drug கண்டுபிடிச்சிருக்காங்க. It will activate the calcium sensing receptor. அது cinacalcet. This is a drug. Cinacalcet. It will directly activate the calcium sensing receptor in the parathyroid. இதெல்லாம் வந்து calcium mimetics. இது வந்து a drug which directly activates the calcium sensing receptor is cinacalcet. So அப்ப என்ன ஆன்சர் அதுக்கு? Aminoglycosides. Which is actually gentamicin in following among antibiotics antigen that mimic on this that inhibit. So gentamicin the answer. Actually இல்ல except so hamycin streptomycin இருக்குல்ல செப்டோ நியோஜென்டா மூணுமே அமினோகிளைகோசைட்ஸ். இதுக்கு உங்களுக்கு ஆன்சரே தெரியலனாலும் நீங்க கொண்டு வந்திருக்கணும். அமினோகிளைகோசைட்ஸ் தெரியலனாலே இது மூணுமே ஒரே குரூப் கண்டிப்பா வராது. ஓகேவா? ஸோ அந்த மாதிரி மோஸ்ட்லி இந்த மாதிரி கொஞ்சம் டஃப் கொஸ்டின்ஸ்லாம் கண்டிப்பா ஈஸியா கண்டுபிடிக்கிற மாதிரி வச்சிருப்பாங்க. ஏதாவது கேன்சல் பண்ற மாதிரி ஈஸியா இருக்கும். ஸோ அந்த மாதிரி. Okay, which of the following drug does not show renal toxicity? Actually, I don't know where it is. Methoxyprenolin. You heard about this drug, methoxyprenolin. I also didn't hear about this drug. I don't know what is methoxyprenolin. Isoprenolin I heard, adrenergic drug. I don't know what is methoxyprenolin. So, okay, you just cancel the drug because we don't know about that drug. Just cancel. So, which of the following drug does not show renal toxicity? So, among aminoglycosides, the main thing is nephrotoxic, ototoxic. So, gentamicin, streptomycin, sure renal toxic. And you don't know about methoxyprenolin. There is no drug among you. So, the answer is, what is isoprenolin? You have to tell isoprenolin. GA. Okay. So, among aminoglycosides, the main important thing is it has a concentration dependent killing and post antibiotic effect. What is concentration dependent killing? What do you know about concentration dependent killing, time dependent killing? What is post antibiotic effect? Anything? So, okay, concentration dependent killing means it inhibitory effects or inhibiting effect depends on the ratio of peak concentration to the minimum inhibitory concentration. So, இப்போ வந்து இந்த ட்ரக்ஸ் எல்லாம் வந்து மேக்ஸிமம் கான்சென்ட்ரேஷன் அதை கொடுத்தீங்கன்னா அதோட எஃபெக்ட் நல்லா இருக்கும். அதுதான் கான்சென்ட்ரேஷன் டிபெண்ட். போஸ்ட் அதுக்கு வந்து அமினோகிளைகோசைட்ஸ் மெயின், ஃப்ளூரோகுயினோன்ஸ் அண்ட் மெட்டனோடோசோல். ஸோ you have to give the aminoglycosides means for gentamicin, if you want to give 80 milligram of gentamicin, you can give us a single dose. Don't need to split the dose. So higher concentration at the time கொடுத்தீங்கன்னா it has a more effect and compared to splitting the dose and giving for more time. So இப்போ gentamicin 80 milligram அப்படின்னா அது ஒரே டோஸ் கொடுக்கணும். இன்ஜெக்ஷன் அப்போ ஒரு 80 milligram கொடுத்தீங்கன்னா inhibitory effect வந்து more compared to minimum inhibitory concentration. So that is concentration dependent. So இப்போ ஃப்ளூரோகுயினோன்ஸ்னா அதோட சிங்கிள் ஓரல் டோஸ் வந்து நிறைய அட் டைம் கொடுத்தீங்கன்னா அதோட எஃபெக்ட் வந்து ஜாஸ்தி இருக்கும். அதுதான் கான்சன்ட்ரேஷன் இன்ஹிபிட்டரி எஃபெக்ட். ஸோ நிறைய கான்சன்ட்ரேஷன் அந்த டைம் கொடுத்தீங்கன்னா இட் ஹேஸ் மோர் எஃபெக்ட், இன்ஹிபிட்டிங் எஃபெக்ட். டைம் டிபெண்டன்ட்னா மோர் டைம் ட்ரக் ரொம்ப நேரம் இருந்துச்சுன்னா இட் வில் பி எஃபெக்டிவ். தட் இஸ் டைம் டிபெண்டன்ட். போஸ்ட் ஆன்டிபயோட்டிக் எஃபெக்ட்னா even after stoppage of the antibiotic there is some inhibitory effect to the organism. That is post antibiotic effect. So clear about concentration dependent, time dependent and post antibiotic. So concentration dependent is inhibitory effect depends on the ratio of peak concentration, and post antibiotic effect is post antibiotic even after the antibiotic free medium. Antibiotic free medium லயும் அந்த organisms வந்து inhibit ஆயிருக்கு அப்படின்னா it is post antibiotic. Aminoglycosides are both concentration dependent and post antibiotic. So the drugs are fluoroquinolones and vancomycin is post antibiotic and also aminoglycosides. For time dependent killing, beta lactam antibiotics, not time dependent killing. Okay. So mostly amoxicillin la twice daily you are giving. So for time dependent, so amoxicillin 3 times கொடுக்கணும். நிறைய டைம் இருக்கணும். அப்பதான் அதோட எஃபெக்ட் நல்லா இருக்கும். ஓகேவா? Okay.